show from the Citizens Bank studio. I'm so thrilled, as I am every single Wednesday, for the second half of the show to have Singing River Health Talk today. Gives me the opportunity to get to know some terrific doctors and other professionals who are working on behalf of Singing River Health System to provide the best possible health care imaginable. And it's been a treat for me, and I know it's been a great treat for our listeners, and I appreciate you joining us each week. And today's really no exception. I've had the opportunity to visit just a little bit with Dr. Lindsay Buono before the show started. And she's a general surgeon. We'll talk about specifically around skin lesions and some work she's doing in that area. But before we go any further, we'll invite her to the show, say hello to her, and find out where she came from. So, Dr. Buono, how are you doing?
I'm doing well today. How are you?
I'm doing fantastic. So I always like to ask where people are sitting. Where are you sitting right now?
I'm in Ocean Springs in the home office.
Yeah. Okay. So you went to Western Kentucky University and eventually, I think, to your doctor of medicine degree at University of Kentucky. You actually did a general surgery residency at the University of South Alabama. And I spent some time in Mobile. I know that system extremely well. Terrific place to go for residency. And then I'm assuming that ultimately led you here. But how did you decide you wanted to get into medicine?
Both my parents are veterinarians, so that had a big impact. I was around medicine at an early age, but of the, veterinary animal type. So I had some exposure in that realm. It's funny, all the veterinarians I talked to said, be a doctor. And all the doctors I talked to were like, be a veterinarian. So that left it a little bit confusing. But I ultimately found my way into doctoring people rather than animals.
Yeah, well, that's interesting. And was surgery the thing that you sought to do? Or is that something that sort of evolved while you were in medical school?
Yeah, that's a good question. Surgery, it has such a bad stigma within the medical community as like one of the rougher pathways to go. And so the mantra we started hearing early on in medical training is if you can do anything else other than surgery, do that thing.
Yeah.
And
yeah.
So I tried to, I always knew I wanted to do surgery. I wanted to be hands-on. I wanted to have that sort of relationship with my patients. So I say I kept an open mind early, just to see if anything could sway me another direction. But I was pretty set on surgery early on. I spent extra time in college shadowing a surgeon in Kentucky, and all that was pretty formative.
Yeah, it's interesting in kind of studying you a bit. You are committed to volunteer work. And, I tell you, throughout my entire career, I always had great mentors that taught me that to be better at what I did in my work life by understanding the community better and as a volunteer is probably the most important thing you could do. It'll help you really complete your career by giving back to the community. Where did your passion for volunteerism come from?
Mostly from my home church in Kentucky. They started a free medical clinic, and I got to interact with a lot of doctors early in my training. We did a free medical clinic in downtown Lexington, Kentucky, and I learned so much. Got to see, the impact we had on people's lives and the impact that they had on us. That we, everybody, every walk of life coming through the door, and the question is, how can I help this person in front of me? Not, thinking of all the barriers and all the things to overcome. It's just like, what can I do today for this person? And so to me, that's the most important thing. Life is too short and life is too hard for us to all be selfish and in our own individual bubble. We got to be thinking about other people. And to me, so many people have poured into my life and given to me. So it's important to give back.
Hey, what's interesting? You talking about Lexington. The Sun Herald used to be owned by Nate Ritter, and the Lexington Herald Leader was it was a sister newspaper to us, and the publisher there was a good friend, and several of the people who worked at that company were good friends, and they loved Lexington, and some had places on the outskirts, and the more I got to know it, it seemed to me that the people of Lexington were very similar to the people of Mississippi. There was first of all, obviously a strong sort of religious base, a strong sense of community. They had terrific pride in their community. They love their places. People who come there, they see the pride in them. But do you find that to be the case as well, that there's a very, in terms of the people, very comparable?
I agree. Very friendly environment, welcoming, hospitable environment in Lexington, Kentucky. And just to be clear, we consider ourselves Southerners up there, and we have sweet tea. So Kentucky's kind of always in that border zone. Are they Northern? Are they Southern? As a Kentuckian, former Kentuckian, we definitely, shoo ourselves into the Southern box. So we'll make that clear.
Hey, listen, I was working on a national project for Knight Ridder with a guy from Lexington, and he had a sailboat on the lake up there. And it didn't occur to me, you was talking about the South and whatever. It didn't occur to me that it can get very cold in Lexington. And we were traveling, and there was this huge cold front that came through, and it actually froze the lake where his boat was. And he said, "Oh my gosh, I forgot to move my sailboat before the lake froze." And I said, "The lake froze? I never imagined that Lexington, Kentucky was a place where the lake froze." But you know that to be the case, don't you?
Unfortunately, yes. That's one of the big perks about being down here is I enjoy the winters. And I, hate it. It chills me now to mention it, but yeah, we'll get sub-zero some years in Kentucky. That's a bad winter.
Yeah. Okay. So as you continue to move forward in sort of general surgery, what are some of the, and we'll get to some of the talking points about the skin lesions here in a second, but what are some of the areas where you enjoyed focusing your attention?
I probably would say my favorite surgery to do is hernia repairs, doing those sorts of operations, inguinal hernias, or the larger abdominal wall reconstructions from, patients that have had multiple surgeries in the past, have a big defect from scarring, scar tissue, a hernia that's opened up over time. And so I think it feels sort of artistic to me, getting to reconstruct an abdominal wall, fill a hole, fill a void. So I enjoy that aspect of what I do maybe the most, but I like it all. I mean, that's by definition why I'm a general surgeon. There are so many options to specialize these days, and actually general surgery is kind of, getting squeezed. For example, I graduated with four other people in my class, and every single one of them did a fellowship except for me. So I really enjoy doing the gallbladders, appendicitis cases, doing the hernias. I do breast surgery, as we'll talk about soon, the skin lesions, skin excisions, lumps, bumps. I'll do colonoscopies. I just resected a colon yesterday. So I really do like the depth and breadth of general surgery.
Speaking of hernias, I had a hernia repair many years ago, and it went well. The technology enables you to do that in a way that's not as, doesn't create as long a recovery effort as it used to. I have an uncle, actually, who had major surgery along the way, and it went really well. Everything was fine. And then some years afterwards, the lesion or the scar tissue, whatever happened, it caused a major hernia in his abdominal area. It really required major surgery to fix. But this is the point that you're talking about, where you have to use creativity to fix something like that. Those can be very challenging, can't they?
Absolutely. A lot of it's a multidisciplinary situation where we have to talk to like weight loss providers. We have to get people on board with their primary care doctors to get diabetes under control, smoking under control, or eliminated, and really try to optimize for somebody like you speak of, like your uncle, you said, because every hernia repair gets more and more complicated. So we try to always tip the scale in our favor, set up, control the factors that we can control, to give the patients the best outcome. But yeah, it's very challenging. Can't be.
So yeah, it seems to me that technology becomes part of the conversation every time I talk to a doctor. I think when you talk to administrators at Singing River Health System, the tens of millions of dollars they have to invest in not just technology, but the kind of up-to-date, cutting-edge equipment that keeps doctors like you wanting to be at Singing River Health System. But that's a big part of patient care, isn't it?
It is. It's funny to mention the complex abdominal wall reconstructions. The big thing for general surgeons is robotics, I would say, getting to use the robotic platform. But I'll make, incisions about a centimeter in size, 6 of them, 3 on one side, 3 on the other, and do this complex abdominal wall reconstruction, put in a piece of mesh. And the patient's like, why am I hurting so much? It's like, it doesn't look like much, but a lot of operating happened on the inside. It's nice that we're able to give them better results without big scars. But yeah, it still is a lot of operating going on the inside, getting to use the tools like the robot, and pain is still much better, going through things on a minimally invasive fashion and recovery faster.
So when we come back, we're going to talk about a specific area, the removal of skin lesions and other things related to the skin that you're involved in. We'll see you after this break. Welcome back to the Ricky Matthews Show from the Citizens Bank Studio. It's Wednesday, so it's Singing River Health Talk, and we're visiting with Dr. Lindsay Buono now, who's a general surgeon from Kentucky. She did residency at the University of South Alabama, and now she's at Singing River Health System and doing a wide range of surgeries. But we're going to now focus a little bit in on, one of the big things here in coastal Mississippi is really paying attention to protecting your skin, and people have to have surgeries of all kinds as it relates to lesions and moles and whatever. Has that become kind of a specialty for you?
It's definitely becoming a bigger thing, and honestly, it's like a word of mouth thing. So I'll see a patient who, I take a mole off, I'll take a skin lesion off, and next thing you know, they're sending their uncle and aunt and everybody to the office to get that little spot that they've had for years looked at and removed. I'll see.
I was just going to ask, because one of the reasons why you do a great job with managing the scars that result from those surgeries.
Yes, that's important to me, is giving a good cosmetic result, and really being thoughtful and planning out the excision to make sure that everything looks good and it's as disguised and hidden as possible.
Having my experience with them, having them removed. My wife just recently had a skin cancer removed. There's some precision that's required, and you guys use all the latest technologies to make sure that you're using that kind of precision, aren't you?
Yeah, yes, sir. Yeah, we take pride in all of that. And for us as general surgeons, we see a lot of patients that come in as new skin cancer consults that have had shave biopsies from the dermatologist. For us as general surgeons, we want to get good margins. We want to make sure we've got the entirety of the lesion and, negative margins around the perimeter, and reduce the chances for any sort of recurrent issue.
People tend not to pay attention to their skin. I think there's probably more awareness these days, but the skin is literally an organ. And if you don't take care of it, it can really bite you. And let's talk a little bit about care and defense of lesions and what to do about moles, et cetera.
Yeah, so you may think like this discussion on skin cancer and skin care is poorly timed as we close out summer, but I would argue that it's not. This is a year-round issue for us in the, on the Gulf Coast in Mississippi. And so really there's like no bad time to have this conversation. And I think, we're at high risk with our location on this globe all year round. So the big thing is protection from the sun. That's the number one risk factor for preventable skin cancers, preventable disease as it pertains to the skin. Sunscreen, hats, staying covered up. We have all the nice fishing gear and the long sleeve shirts. To that degree, I'd say have them on. Make sure you're protecting your kids. But yeah, prevention is key. And I think I'm hoping that we see soon a switch from the popularity of all these nice skin, the sun tans, and, there's a difference between being sun kissed and being burnt. And, as you get older, those age spots, the old spots from years of skin damage out in the sun when you're younger, aren't as attractive. So I'm hoping people start to swing the other direction and really put pride in putting that sunscreen on, reapplying, taking good care of their skin.
It's interesting. One of the topics that have come up with doctors and on Singing River Health Talk has been there's advanced technologies available to enable doctors to determine if someone has a spot on their lung that needs to be addressed. That by the time you have symptoms, and in many cases, it may be too late. And in talking with doctors who have responsibility for colons and et cetera, they're dealing with patients that have had some kind of symptom for some period of time and have just not addressed it. Same thing is true about the skin. But you see this as a general surgeon sort of across the spectrum, that people, for whatever reason, may tend to wait too long. And there's reason to not wait. There's reasons to be much more proactive about your body and annual checkups and all of that. So make your case about that.
Yeah, absolutely. I think that's a huge thing. Screening is so important. Catching things early is so important. The later that you intersect with your doctor, and something that is late stage, that's advanced, the less we're going to be able to do to help. The more we'll have to switch and shift into more of a palliative thing, managing symptoms, that sort of thing. And that's one of the hardest things it is to see, I think, as a general surgeon or as a healthcare provider, is stuff that, man, if we just caught this a year or two earlier, we would be having much different conversations now. And so I very much am a proponent for those screening colonoscopies, mammograms, skin checks, doing all of that routine maintenance stuff so that we can have an opportunity to intervene and help earlier. And, in that way have to be less invasive, less costly to both the patient and the healthcare system and everybody.
Well, I know just from talking to you, as you care deeply about your patients, it's got to be heartbreaking at times to see if only we would have had having this conversation 6 months to a year ago. But we're out of time for today. But Dr. Lindsay Buono, it's been a pleasure to spend some time with you. You're no exception to the rule. You care deeply, and it's been great to meet you.
Yes, thank you so much for having me on the show. I really appreciate it.
Yeah, it's been terrific. And listen, have a great day, and we will see you tomorrow.